Minister Donohoe, you were in charge of the nation's finances for around half a decade, and under your watch spending on healthcare ballooned to roughly €10 billion a year more than before you took over. So looking at the state of our accident and emergency departments today, do you think you got value for money?
Yes, I do believe the investment that we put into our health services over those years has made a really big difference. Why do I believe that? It's because we've 17,000 more equivalent of full-time people now working with our health service. 17,000. Those numbers began to grow before the pandemic. It accelerated during the pandemic, and those nurses and doctors are now working in our primary care centres and our hospitals, making a big difference. The second reason why is I can see what that investment has got us physically. If I look at where we are at the moment, a decade ago, if you were ill, you needed support. If you couldn't go to a GP, you went to the Mater Hospital. If I look at where we stand today, you've got a primary care centre in Grange Gorman that you can now go to get care that a decade ago wasn't available. You have a primary care centre in
But Minister, with respect,
that wasn't available
if
a decade
that's
ago.
The case,
We've got a primary care centre. Hang on, nobody else interrupted.
Sure, of course.
Anybody an answer?
Absolutely.
We have a primary care centre down in Summerhill that's providing state-of-the-art medical support to local communities that, again, a decade ago wasn't available. If I go into the Mater Hospital, if I look at the extension that is now available there,
well, why then are waiting lists worse than they've been?
For the second time.
But Minister, I don't think you're answering my question.
No, for the
Minister.
second time, you've interrupted me when nobody else is. I'm going to finish off my answer.
Sure.
Which is to then point to the 110 beds that are now being built in Eccles Street by the Mater, which is about the care that is available. Now, I'm aware, as all of us are, of the huge pressure that emergency departments are facing at the moment, as they're facing all over Europe and all over the world. So did we get value for that money? Yes. Do we need to do more? Yes, we do too.
Okay, thanks everybody. Thank you.
Thanks everybody. Thank you.